Okay, so we're going to go into our side planks. Side planks have high EMG, that means muscle activity, with low spinal compression. We're going to start with the mini plank and allow our spines to prove itself worthy of doing the full side plank. Okay, so it can be aggravating for a symptomatic spine to go through this side flexion. So what I'm going to instead do is I'm going to hip thrust through it. So it's like that. It's more of this extension and flexion moment rather than like this side bending. Okay? Couple things. People often complain about their shoulder. If I'm like this, I'm going to start to complain about my shoulder. I'm going to push through the floor, which gives me good scapular stability there. If you were to take a bird's eye view, you would see a straight line between my shoulder, my hip, and my knee. I'm not here, nor am I rotating. I'm stuck between two planes of glass. I'm going to keep nice daylight under my bottom hip. So evidence of fatigue would look like this, where I start to side bend and get a little bit of shearing on the spine. My emphasis and my focus is on that bottom hip. I'm going to start to burn in my lateral glute on my right side, as well as my oblique. I'm going to hold it for a minimum of 10 seconds, up to 30 if I'm really championing it. And then I'm going to come back down in the same fashion. I'm going to flex at the hip and come back down rather than side bend. I would do 1 repetition left, 1 repetition right, alternating back and forth. The progression here would be going into your full side plank. So traditional positioning would be top foot in front. You'll see it online in the forums and even textbooks where people are stacked like that. Doesn't have the same effect. Top leg in front, back leg or bottom leg behind. Once again, I'm going to flex and then hip thrust through it as I come up. Again, I'm going to have the propensity to rotate because it makes it easier. Often, you can also come across, like I'm saying the pledge, and I'm popping my hand on my shoulder to make sure that I'm not sitting there, sitting up. I'm driving through that right elbow so that I'm stuck in the plane of motion. Nice easy breath to have authentic respiration as well as core stabilization. Not sacrificing one for the other. Okay, and then I would do my same descent where I flex a little bit, flip over, do the other side. If I was going to do the front plank, I'd do the same. So I'd start on my knees, and I'd be like this, okay? And it looks funny because my butt's up in the air, but my spine is otherwise neutral relative to the floor. If I want higher demand, muscularly, but with less stress, then what I'm going to do is I'm going to pull down on the mat. So I'm trying to bring my elbows once again to my knees and my knees to the elbows. Big breath in through the nose. Big breath out through the mouth. Nice and slow, despite being under physical demand, I'm able to maintain respiration. I would come down, and then I could, once I've owned that for a minimum of 2 weeks, allowing my spine to prove itself worthy, I would go into my full plank. Once again, hip up in the air, a little bit of posterior pelvic tilt for glute activation, and I'm here. Okay? I'm not there. Nor am I going like this in my triangle position. I'm separated, I have palms slightly up, which gives me a little bit more lat engagement, God's given back brace.